eyeballs can move in various directions within the orbit due to activity of extraocular muscles. These muscles work in pairs and bring about coordinated movements of eyes. The main purpose of various ocular movements is to form a clear and steady image of the object of interest on fovea. Today we shall learn different types of ocular movements, their purpose and clinical aspects associated with the topic. But before we begin, this is Pratima and you are watching Planet Physiology. Okay, to understand this topic, you must know various extraocular muscles, their nerve supply and actions. Details of this part is already discussed in clinical examination of 3rd, 4th and 6th cranial nerves, and the link for the same is shared in the description box below. Let's quickly revise the important points. Each eyeball can be moved by 6 extraocular muscles, 4 recti and 2 obliques. Oculomotor nerve, that is the 3rd cranial nerve, innervates superior, inferior and medial rectus and inferior oblique muscle. Trochlear or the 4th cranial nerve innervates superior oblique, and abducens, that is 6th cranial nerve, innervates lateral rectus. Adduction, that is medial rotation of eyeball, is caused by medial rectus, and abduction, that is lateral rotation, by lateral rectus. Elevation and depression is regulated by coordinated activities of superior and inferior recti as well as oblique muscles, and their relative contribution in the movement depends on horizontal position of eyeball. When eye is in its primary position, that is looking straight ahead as indicated in the picture, elevation is brought about by both superior rectus as well as inferior oblique muscles, whereas depression is brought about by inferior rectus and superior oblique. Superior and inferior recti also contribute to slight adduction, while obliques cause slight abduction. The oblique muscles are also primarily responsible for torsional movements, that is, movement along the antero-posterior axis. Intorsion is medial rotation of cornea towards the nose along its antero-posterior axis. It is mainly caused by superior oblique and to a certain extent by superior rectus. Similarly, extorsion, that is lateral rotation along the antero-posterior axis, is mainly caused by inferior oblique but also by inferior rectus. When eye is in adducted position, prime elevator is inferior oblique and depressor is superior oblique, whereas in abducted position, elevation is mainly contributed by superior rectus and depression by inferior rectus. With this basic knowledge, let's begin with the main topic, ocular movements. Ocular movements can be voluntary or involuntary. They can also be classified as duction movements, which involve movement of only one eye, and binocular movements where both eyes move simultaneously. If eyeballs move in same direction, where both the visual axes remain parallel to each other, the movement is called as vergence. And if they move in opposite direction, the movement is called as vergence. If visual axes converge, the movement is convergence, and if they divert, the movement is divergence. Based on the purpose, ocular movements can be divided into gaze shifting movements, which include saccades and pursuit movements, and gaze stabilizing movements, which include vergence and vestibulo-ocular reflex. Today we shall study these 4 movements in detail. The basic purpose of ocular movements is to focus the object of interest on fovea and keep its image steady to achieve the highest level of visual acuity. This involves both voluntary as well as involuntary movements. Let's begin with the saccades. Saccades or optokinetic movements are rapid, ballistic movements of eyes between the fixation points. Thus, they shift the gaze from one point of interest to another point. This jumping of eyes from one fixation point to another is termed as saccade, and the resulting movement of the eyes is called as optokinetic movement. Saccades can be voluntary or reflex in nature. Their amplitude, that is, distance between two successive fixation points, vary depending upon the visual scene. For example, it is less during reading but large while gazing around the room. Saccades are commonly observed while reading, where gaze jumps on few words in a line instead of following the line smoothly. Saccades are also seen when the person observes his surrounding or while looking out from a moving vehicle. Eyeball movements during rapid eye movement sleep is another example of saccades. During saccadic movements, eyes first locate the object of interest. This is voluntary fixation mechanism and it is mediated by premotor area, mainly the frontal eye field area. Once the object is located, eyes are fixed or locked on that object by involuntary fixation mechanism. Center for this locking mechanism is secondary visual cortex, which mediates it with the help of superior colliculi. In case of bilateral lesion in this area, the person cannot fix the eyes on a particular object. In contrast, the persons with bilateral lesions in premotor cortex finds it difficult to unlock the eyes from the object and move them to another. Saccades prevent adaptation in visual system and reduce strain on the extraocular muscles. Next type of ocular movement is smooth pursuit movements. These are the tracking movement of eyes while following the moving object. For example, as you can note, following the tennis ball or a player during the tennis rally. These are voluntary movements where the observer decides whether or not to track the moving stimulus. It is highly developed cortical mechanism that automatically detects the course of moving object and then rapidly develops a similar course of movement for eyes. These movements are integrated in cerebellum. The sole purpose of pursuit movements is to keep moving stimulus in focus. Now coming to the third type, vergence. Vergence movements are disconjugate movements of eyeballs where visual axes either converge or diverge as per the distance of object from the eyes, so that the object remains in focus despite of the distance. As you can make out here, eyes converge to see near object and diverge as the distance increases. Vergence also makes sure that the image of the object falls on the corresponding points on the retinas. As eyes are about 2 inches away from each other, the image formed on two retinas is not exactly the same. This disparity increases as the object moves closer to the eyes. Thus, convergence helps in stereopsis, that is, depth perception. It means to judge the distance of object from the eyes. This mechanism can judge the distance up to 60 meters. The last type of movement is vestibulo-ocular movement or vestibulo-ocular reflex, which is abbreviated as VOR. It is the reflex movement where head movement initiates movement of eyes in equal proportion but in opposite direction. That is, eyes move in equal and opposite direction to that of head. This allows object of interest to be in clear focus with proper orientation in spite of head movements. Vestibular apparatus detects the head movement and sends signals to the extraocular muscles via medial longitudinal fasciculus. This initiates eye movements in the opposite direction. As shown in this picture, panel A is normal view of the scene when head is normally oriented. As head is rotated, orientation of scene also gets rotated. But immediately due to VOR, eyes turn to the opposite side and corrects the orientation of the scene. Thus, in spite of now tilted head, image remains in focus with correct orientation. Apart from these 4 types of movements, eyes also show continuous but imperceptible movements that include ocular microtremors, which are small, quick and synchronized oscillations of eyes with frequency ranging between 40 and 100 Hz. These are due to successive contractions of motor units. But now it is believed that they are due to activity of oculomotor nuclei. These tremulous movements cause the image to move back and forth across the cones rapidly. Image not only moves back and forth, but also it slowly drifts from one point to another point, and these movements are called as slow drifting movements. During drifting, if image reaches the edge of fovea, then sudden flicking movements or microsaccades bring them back to the center. These flicking movements or the microsaccades are regulated by involuntary fixation mechanism. All these movements prevent adaptation in the visual system and allow to observe the object for sufficient duration to perceive its fine details. Now coming to the regulation of ocular movements. Neural circuits from frontal eye field area to pretectal nucleus, oculomotor nucleus and other brainstem areas regulate voluntary fixation, that is, to seek the object of interest. Visual association area along with superior colliculus are involved in regulation of involuntary fixation mechanism. Superior colliculi have map of retina, somatic sensations as well as acoustic signals. They are well connected with other inputs from visual cortex, basal ganglia and brainstem nuclei including vestibular nuclei. Hence, they are also responsible for turning of eyes as well as head or the entire body towards the source of stimulus. Other areas related to ocular movement include cerebellum, acting via vestibular nuclei and medial longitudinal fasciculus, basal ganglia, pretectal nucleus, and reticular formation. They influence the activity of extraocular muscles through 3rd, 4th, and 6th cranial nerves. With this basic understanding, let's study some clinical aspects. Defects in ocular movements can result due to various causes like defect in 3rd, 4th, or 6th cranial nerves, which innervate extraocular muscles. In such cases, the muscle innervated is paralyzed, leading to overactivity of its antagonist. For example, 4th cranial nerve palsy causes paralysis of superior oblique, resulting in elevation of the resting eye. This is due to unopposed activity of inferior oblique and superior rectus. Eye movements may be affected due to muscle disorders like myasthenia gravis or due to orbital diseases like tumor or fat deposit behind the orbit. Patient may complain of squint, diplopia, nystagmus or poor visual acuity. Squint is also called as strabismus. In this case, visual axes of two eyes do not match. Based on the coordinates which do not match, squint may be horizontal, vertical, torsional, or combination of above. In such cases, eyes do not focus on the same object simultaneously. If it develops in children, brain suppresses the image formed on one retina. So only one eye is used for image formation. This condition is called as amblyopia. Severe form of strabismus may result into diplopia, that is double vision, where person perceives two images of single object. This is because the image of object does not fall on the corresponding regions of retina. Diplopia can also result due to excessive stretching of eyeballs, as in case of severe exophthalmos. Another abnormality associated with ocular movements is nystagmus. Nystagmus is involuntary, rhythmical, oscillatory movements of eyeballs, which can be unilateral or bilateral. Eye movements in nystagmus may be in any direction and can be seen in cerebellar or vestibular disorders, stroke, multiple sclerosis, etc. Presence of nystagmus reduces visual acuity as well as depth perception, that is stereopsis. So, as we have finished the topic, let's quickly summarize the important points. There are 4 types of ocular movements. Saccades are rapid ballistic movements which abruptly change the fixation point. Example, eye movements while reading. They have voluntary as well as involuntary components which are regulated by frontal eye field and visual association area respectively. During smooth pursuit movements, eyes track the moving object. Example, while following the tennis rally. These are voluntary in nature and are programmed in cerebellum. Saccades as well as pursuit movements are gaze-shifting movements. Gaze-fixing movements include vergence, where eyes converge or diverge as per the distance of object. They help in maintaining focus in spite of changes in the distance and also help in stereopsis. Vestibulo-ocular reflex is also gaze-fixing movement that causes eyes to move in equal and opposite direction to that of head and maintain clear image in spite of changes in head position. This is involuntary movement initiated by vestibular apparatus. Basic purpose of all ocular movements is to maintain image on the fovea and prevent visual adaptation. Ocular movements are regulated by visual cortex, eye field areas, superior colliculi, pretectal nucleus, radicular formation. All they alter impulses in 3rd, 4th and 6th cranial nerves supplying extraocular muscles. So that's all for this session. Thank you for watching and see you in the next video. If you enjoy my presentations, press the like button and share it with your friends. For more such videos, subscribe my channel and click the bell icon. Thank you for watching and see you in the next video.